This is Hello Healthy, a Dignity Health podcast. I'm Amanda Wild. What makes a well woman? Today we'll talk about lifestyle medicine with Dr. Ann Kennard. Dr. Kennard is Associate Director of the OBGYN Residency Program and Director of Integrative Lifestyle Medicine at Marion Regional Medical Center in Santa Maria, California. Welcome, Dr. Kennard.
Hi, thanks for having me.
So what is this medical approach called lifestyle and integrative medicine?
Thank you. Yes, lifestyle and integrative medicine are two newer specialties of medicine, and anybody that is in any specialty can certify and learn these disciplines. And they are overlapping, but not quite the same. Lifestyle medicine includes 6 pillars, which are healthful eating, physical activity, sleep, stress management, healthy relationships, and avoidance of risky substances. And you see that overlapped and also added to in integrative medicine, which really focuses on integrating all available and evidence-based therapies. And so it has conventional medicine and surgery, along with the pillars of lifestyle medicine, along with evidence-based supplements, botanicals, and whole health systems like traditional Chinese medicine and acupuncture.
So what are those pillars of lifestyle medicine again? Healthful eating, physical activity,
sleep, stress management, healthy relationships, and avoidance of risky substances is how they're defined.
Okay. And what are issues, thinking about those pillars, that are particular to women that you work with?
Thank you. Yes, I think that a few stand out to me. And I think about this a lot, right? I'm in OBGYN by primary training, and women come in for so-called well woman exams, their annual yearly exam. And the focus of that exam often is on cancer screening, like Pap screening for cervical cancer, ordering age-related screenings like mammogram, colonoscopy, immunizations, etc. But diving a little bit deeper on that, a lot of women I find have questions on nutrition, or they're not sleeping well. I think pretty much every modern woman has a significant amount of stress. And so these are the kind of deeper dive topics that I often will discuss with patients.
Yes, because I just mentioned to a friend the other day that I slept well, and she had never even heard of anyone in our age group that slept well. So that really does affect so many women. So how do you address that with lifestyle medicine?
Yes, sleep is such an important topic. I mean, really nothing works well without good sleep. It's so crucial for well-being, healthy metabolism, immune function, mood. It is just, I think, probably the most overlooked determinant of well-being. And so there's a few things that I speak with patients about. So a few concrete tips, having early morning light, like going out in the morning for a few minutes, and that resets the melatonin production and just gets the body on a normal circadian rhythm. And then similarly, starting to dim the lights on the evening, turning off electronics, ideally at least an hour, hopefully 2 before bed. And thinking too about the role of food in sleep, that it's difficult to sleep well, or sometimes people have issues with heartburn if they have a heavy meal before bed or snacking before bed. And so making the midday meal the primary meal of the day, and then maybe backing up dinner to be a little bit earlier can sometimes help folks. But really it gets after a deeper question, which is, what kind of rest does someone need? Are they not sleeping well at night? Do they wake up in the middle of the night? Or maybe they need a different kind of rest, like stillness to decompress, or a break from responsibility, connection to art or to nature, time to do something, quote, unproductive or not be helpful. These are types of questions that I don't think are talked about a lot, but the lack of this types of rest really contributes to our feeling of burnout and not being well rested overall.
How does a woman make her way to you? How do you end up seeing people?
I see patients alongside the resident physicians for integrative and lifestyle medicine consult through the Family Medicine Center at Santa Maria, California at Marion Regional Medical Center. And I also work as an OB hospitalist, and so if somebody comes in needing inpatient obstetrics care, I am there as well.
And then how do you assess then what is needed for each individual?
In terms of the integrative and lifestyle medicine components?
Yeah, when a patient comes in, what are you looking for when you're designing a treatment plan?
Mostly I listen to people. Usually folks are there for a reason, and I ask them what they're hoping to get out of our time together and what their questions are, and then go from there. It's really patient-centered.
Just thinking about the sleep, like someone might describe their sleep pattern to you, and then I assume you can then assess and make some suggestions.
Right, and make some recommendations regarding sleep, ask some deeper questions maybe about their sense of their sleep and their rest. Often for women around the time of the menopause transition, sleep can become disrupted, so evaluating if something like hormone therapy is indicated for other reasons, along with nutrition, exercise. Sometimes things like acupuncture can be really helpful for sleep. And so it just really depends on what someone's needs are, and that's where we go.
And when you have given a treatment plan, so to speak, do you coach people through the process?
You know, one of the nice things about the clinic that I'm at currently is we have really long visits. We see patients for an hour for an initial visit, 30 minutes for a follow-up, which is really unheard of in conventional medicine. And so I actually have enough face-to-face time to really take time with people and talk it through. And then we come up with a few things that the patient is going to implement or think about implementing or learn more about over the next few weeks. And then generally we'll check back in 4 to 6 weeks and see how things are doing and make a few more tweaks going from there.
Yeah, it's great that you have such follow-up, because when we're changing habits, we need support, right?
We do. You know, this is where coaching comes in too. Like health coaching has become a really big industry, and I see more and more insurance companies paying for that. And I think it's a wonderful modality to have somebody trained in behavior change walking alongside.
Now, we touched on a few of the pillars of lifestyle medicine, but one I want to concentrate on a little bit is healthful eating, because along with your other credentials, you authored a best-selling cooking guide called Nourish, an integrative medicine cookbook.
Thank you. I am proud of that work, and nutrition is really my original love. I have a nutrition science degree from Cal Poly and love food, love culinary medicine, love gardening and growing own food, and just very passionate about helping folks make nutritional changes that work for their lives, things that taste good. I really love to focus on adding things in rather than taking away, and working to find solutions that work for busy families in any budget and with folks with minimal time. I know that too. I have 2 little kids, and you know, it's hard to make this work for your life. So what solutions can we come up with together that are going to really be sustainable?
Especially when you're talking about cooking, because that's a task that often does fall to women, to bring nutrition and healthy meals to the whole family. And I'm guessing, since your book was a bestseller, that there's something simple about it that makes it successful for anyone wanting to try.
That was the goal, to bring in recipes that were simple, didn't have too many ingredients, did not require previous cooking experience or skills to produce, and it was all stuff that my own kids would eat.
Right. That's really important. You were already an OBGYN, and then what got you interested in lifestyle medicine? I'm guessing all the things you've mentioned, combining all these areas of life.
Well, that was exactly it. Yeah, like my background in nutrition, But I was also a yoga instructor and very interested in well-being. And while I loved my training in obstetrics and gynecology, it just struck me as being very acute medicine and not as much focus on preventive and well care, which was really where my heart was. And so when I learned about integrative and lifestyle medicine and really the formal study and discipline of these sorts of topics, I was really excited to get that training and become boarded in those disciplines as well, and then integrate, if you will, all of the above into one practice, as well as teaching the resident physicians about this so that more doctors are knowledgeable in practicing this sort of medicine.
Well, this may not be a fair question, but what's the most rewarding thing to you about your work?
You'll have to let me have two answers on this. So the first rewarding thing is when I get to see a person and we address whatever they want to talk about, and I see them back in a month or so, and they say, I am feeling so much better, whatever it may be, their energy, mood, sleep, feeling better about nutrition, they've been successful with weight loss, etc. But just feeling like the work made a difference in a way that I feel will be positive and sustainable for that individual. So that's the first one. And then second one, which is a close second, is I always have a learner with me. And then seeing that resident physician become comfortable and competent with these topics, which are not well covered in general medical training, and knowing that's going to ripple forward in their practice going outwards.
Yeah, it sounds like it's so much about support and healing and then passing that on to the next generation.
Exactly.
What a pleasure to hear about this really holistic medical approach and way of life. Thank you for all the great information and for sharing your time and expertise today.
Thank you for having me.
Call Family Medicine Center in Santa Maria at 805-739-3561 for more information on lifestyle medicine. If you found this podcast helpful, please share it on your social channels and be sure to check out the podcast library for other topics of interest to you. Thanks for listening to this episode of Hello Healthy, a Dignity Health podcast.